Good morning and welcome to This Week in Cincinnati. Today we are speaking with former state representative and Democratic candidate for governor Connie Pillich. Pillich is from Montgomery and represented the 28th district. She ran for state treasurer in 2014. She is also an Air Force veteran. She joined the Air Force in 1983, left active duty in 1991 as a captain. Pillich faces three major candidates in the Democratic primary: State Senator Joe Schiavone, former Congresswoman Betty Sutton, and Dayton Mayor Nan Whaley. Connie Pillich, thank you so much for joining us for This Week in Cincinnati.
It is a pleasure to be here. Thank you.
You are on an 88-county tour and campaign trail here. How many counties have you hit so far?
We have now visited 60 counties, and I decided to do an 88-county tour because really for a long time, members of both parties have just forgotten so many parts of Ohio, and it really shows. So I decided I needed to give everybody a voice, and frankly, I feel obligated to hear those voices. You
talk about, in previous interviews with other news agencies, you've spoken about the rural areas in the shadow of Columbus. Many of those rural areas in Ohio, specifically here in our region, both rural and in Hamilton County, Butler, Warren, the heroin issue is top of mind for so many people. What would be your position if you became governor to tackle the opioid and heroin issue in our communities?
Well, the heroin epidemic is the largest public health crisis of our century, and we really need to attack it from all sides. I always start with jobs because the dignity of work, the sense of community it gives you, the ability to support your family, these are things to fight for, and it's our first line of defense in preventing people from starting to use these drugs. We also need to embrace every kind of prevention that is out there, whether it's through police officers, schools, doctors and nurses. We have to keep people from starting to use the drugs first. We need to have effective treatment, and we have to acknowledge that treatment doesn't always work the first time. We have to give people second chances, and to pay for this treatment we have to keep those Medicaid dollars flowing because that's paying for the treatment for thousands of Ohioans right now. Our families need support too. Addiction is a disease that affects the entire family, not just the user, and these families have to be able to cope and provide a supportive environment when the recovering addict returns home. And finally, we've got to be strong on enforcement. I want to see these drugs off our streets, out of our state, put the dealers and the pushers in jail. And as governor, look, we have to attack this from all sides, but that also means the state has got to stop siphoning off the funding for our local police, our local jails and hospitals. These are the folks fighting this epidemic on the front lines, and for the last 7 years, the politicians in Columbus have been taking away their funding just to use for tax giveaways for their donors.
When we're talking about medical marijuana, it's something that is slowly making its way into the Buckeye State as rules and regulations get into place. What is your take on medical marijuana? Are there any restrictions or any protocols that you think should be set up moving forward to better manage medical marijuana in Ohio?
Well, absolutely. I know the legislature is working on creating the regulations that the state will operate under. But look, while I was in the legislature, I was contacted by family after family after family whose children were suffering from certain types of ailments that they felt their only hope was to get to a state where medical marijuana was allowed. And don't make any mistake, this is not people token up. This is allowing medical professionals and scientists to do the research we need to find out the ways to use the cannabis, the non-hallucinogenic portions of this, to provide treatment for illnesses and diseases in our state. And
there are some people, though, that would argue and say that it does become a toking up, to use your words there, issue, because in some states like California, when it rolled out, the list of reasons why you could be prescribed medical marijuana was several pages long, and somebody could go in and say, I have migraines, and they get a medical marijuana card, and for $70 for that card, now they could go buy medical marijuana and they could do whatever they want. And the varieties of medical marijuana out there are extensive. So how do you control that and keep it from just going to those who truly need it for medicine and not those who want it just because they want to smoke marijuana legally?
Well, we have to have some element of trust of our medical professionals. They follow the rules and guidelines of the medical board, and our health department has a role in that. But we do have to, and the pharmacy board as well, we do have to have some element of trust and allow the professionals who know what they're doing to do the right thing.
Infrastructure is a huge part of the state. Of course, fortunately right now, like on I-71 here locally, we're seeing tons of paving, and 75 has work going on. Brent Spence Bridge has been a major point of interest, not only for voters, but for those on the campaign trail. And people stand, and I've said this same phrase when I interviewed John Husted and others. People stand in front of that bridge and they promise to fix things, and they promise to fix things, and they use that as an anchor point. So as governor, how can you work with Kentucky? How can you get Brent Spence taken care of where it's not an issue anymore?
It is kind of puzzling. For many years, we had the president of the Senate who lived in northern Kentucky on one side of the bridge, and the Speaker of the House who lived in Westchester on the other side of the bridge. And I don't know who else we got to know if we can't get them to fix the bridge. But this legislature has done a number of things. In Ohio, we've done all the things that we need to do to be prepared to move forward to build a new bridge. But a huge portion of the nation's commerce travels across that bridge, and we all know it's functionally obsolete. We all know that accidents can be deadly on that bridge, and we need to work with the government of northern Kentucky. That seems to be the holdup. But that is not the only piece of infrastructure that I talk about. Infrastructure is a key element of my 5-point jobs plan, and when I talk about these bridges and roads, I also want to talk about the things not just for cars and trucks, but the roads and bridges, so to speak, for our rail, because a good portion of our commercial freight is carried by rail. And another thing we have to think about is our communications and our internet infrastructure. We have to be in the 21st century. We got to keep moving forward. Cleveland has fiber optics. It's the best in the state. Well, let's model that. But across the state, access to high-speed internet is still a problem in 2017.
Right.
There are many parts that don't have it. And you can't compete in the global economy of the 21st century if you don't attack all of these pieces of infrastructure for our state.
All right, our conversation is going to continue in just a moment. On the Republican side, Ohio Attorney General Mike DeWine, Secretary of State John Husted, who we've had on this show, Congressman Jim Renacci, and Lieutenant Governor Mary Taylor are running in the GOP primary. Nine on Your Side has invited all the major candidates to join us on This Week in Cincinnati, and we've already spoken, as I mentioned, to Secretary Husted. You can see that interview, by the way, on the Nine on Your Side YouTube channel. We're going to continue our conversation with Democratic candidate for Ohio Governor Connie Pillich in just a moment.